The tragic death of 22-year-old William Hewes on January 21, 2023, at Homerton Hospital, echoes the heartbreaking circumstances surrounding the 2021 passing of 13-year-old Martha Mills, raising profound questions about systemic failures within healthcare. Both cases highlight a devastating pattern: preventable deaths due to unacceptable delays in critical medical interventions, leaving grieving families grappling with the devastating weight of what could have been. William, a bright and promising young man studying politics and history at Leeds University, succumbed to meningococcal septicemia. The inquest, presided over by Coroner Mary Hassell, the same coroner who investigated Martha Mills's death, unveiled a harrowing account of missed opportunities and medical miscommunication that ultimately cost William his life. The stark reality is that this wasn't a singular instance of negligence. It represents a systemic issue demanding immediate and comprehensive reform. The tragedy is amplified by the fact that William's mother, Dr. Deborah Burns, a consultant pediatrician at Homerton Hospital, was present throughout his ordeal. Her professional expertise and deeply personal connection to the situation should have ensured William received the timely and appropriate care he desperately needed. Instead, she witnessed firsthand a chilling disregard for her concerns and repeated pleas for immediate antibiotic administration. Dr. Burns's testimony painted a picture of bureaucratic inertia and a failure of communication that tragically unfolded in real time. Despite her urgent requests, vital antibiotics were inexplicably delayed until 1:25 a.m., a delay that the inquest attributed to a regrettable misunderstanding between a doctor and the nursing staff. This critical delay, occurring within the crucial first hour of his treatment, drastically reduced William's chances of survival. The urgency of the situation was further underscored by the additional 90-minute delay in transferring William from the resuscitation area of A and E to the intensive care unit, a delay rooted in internal disagreements among medical professionals regarding the escalation of his care. The inquest's findings lay bare a system riddled with communication breakdowns and a lack of responsiveness to parental concerns, echoing the failings highlighted in Martha Mills's case. Martha's death, also caused by sepsis following delays in treatment, galvanized significant change, leading to the adoption of Martha's Rule in several hospitals, including Homerton. This rule, a direct response to the tragic circumstances surrounding Martha's death, empowers patients and their families to request an urgent review of hospital treatment. Paradoxically, even with Martha's Rule in place at Homerton Hospital, William's case demonstrates that the rule, while a positive step, is insufficient to prevent similar tragedies. Dr. Burns, deeply affected by the loss of her son and the perceived betrayal by her colleagues, has been unable to return to work since the incident. Her testimony reveals not just a personal tragedy, but a systemic failure that demands urgent attention. The emotional toll on Dr. Burns, a highly trained medical professional who is unable to prevent her son's death, is immeasurable. Her experience underscores the profound psychological impact on healthcare professionals. When they witness such failures within the very system they dedicate their lives to serving. The inquest findings raise critical questions about hospital protocols, communication procedures, and the responsiveness of medical staff to parental concerns. Were established procedures properly followed? Were communication channels adequate? Was there a culture of deference that prevented junior staff from challenging senior colleagues, leading to fatal delays? The answers to these questions are vital not only for ensuring justice for William and his family, but also for preventing similar tragedies from occurring in the future. The parallel between William Hewes and Martha Mills's deaths is chillingly striking. Both cases expose the devastating consequences of delayed treatment, highlighting the urgent need for systemic change. While Martha's Rule represents a positive step towards patient empowerment, it clearly demonstrates its limitations in preventing these tragedies when faced with ingrained systemic issues and communication failures. This is not simply a matter of individual negligence. It's a systemic issue demanding a thorough review of hospital protocols, staff training, and communication systems. The heartbreaking loss of these two young lives underscores the imperative for urgent and meaningful action. The hope is that the inquest's findings will spur significant changes within the healthcare system, preventing other families from enduring the same unimaginable pain and grief. The tragic deaths of William and Martha serve as stark reminders that timely intervention is not just good medical practice. It is a matter of life and death. Their legacies should inspire immediate and comprehensive reform to ensure that no other family has to endure such a devastating loss due to preventable medical errors. The weight of their untimely deaths should not be borne in vain. Their stories must serve as a catalyst for change, a profound call to action to prevent similar tragedies from ever happening again. The system must learn from these painful lessons and prioritize the timely and effective delivery of critical care to every patient, regardless of their circumstances. Only through comprehensive reforms can we honor their memory and prevent future tragedies.